time, 10 days ago, that the state was recommending that we,
We'll talk about that. We have a budget section.
yeah, and I had to make an amendment. You want me to do it later? Or just to make you aware that we switched?
Under the health officer's report.
Yeah, sort of.
Okay, all right.
All right,
Continue on.
I'll make it quick. The state, Dr. Lindsay Weaver, the state health officer, advised the health departments at a recent statewide meeting that they should spend down all of their HFI money because the state legislatures are looking for the different health departments to use all their money. If they don't use it all, then it's felt not to be necessary and would impact the following two, because the budget on a 2-year cycle, the 2-year award for HFI money. So we had already done our budget. The finance committee meeting had met, but we realized that we were going to have money left over in the HFI account. And so we had a meeting, special meeting, and I talked to everybody on the finance committee about this, either corporately or individually, about switching some of our county health budget over to HFI funding and so that we could spend out all the HFI monies, A, and B, help the county because the county has their fiscal cliff in 2027 when they have less tax revenues coming in. And so it will help the county try to cut back on their spending. The idea being then in 2028, there would be revenues from the Amazon plant starting to come in to the county. And we're just trying to help the county get through that 1 year, 2027, where money's going to be short, and also appease the people downstate who are deciding who gets what kind of HFI money. So I just wanted to explain that came up at a late time after we'd already had the finance committee. So that's one thing. I wanted to tell you that the team has been very, very busy. We had some massage establishments that were recently closed on Friday because of our ordinance, and environmental has been incredibly busy since that time, trying to get everyone in line with the ordinance and code. We are starting the new season of events, and so our nursing team is getting the mobile unit warmed up. And if you have driven by the parking lot, you can now see our MERV parked there, and we've got it hooked up so that the refrigerator runs and keeps things cool. We have been meeting regularly for the budget. As I mentioned, we are about as lean as we can be with the budget, so we are very aware of opportunities to improve. One of the things that we really cut back on this year, and Amy could probably speak to it, is our printing costs. We're trying to keep as much as we can in-house and not having the most bougie flyers out there, but printing by using our own paper and our own ink. We have saved a lot of money there. Amy found a deal where we could all get our cell phones replaced for 99 cents. And we're in the throes of that. We've really cut down on the number of people with cell phones. So we're turning those in for credit, getting those monthly bills or annual fees off of our balance sheets. We're really trying to figure out ways to save money and stay lean and be very responsible as much as possible. We've had people, administrative assistants, who will Google prices that we're getting from a medical supply company and then see what we can do on Amazon. And we've saved a lot of money doing that. It takes a village. And I think that everybody recognizes that we really need to be very responsible, and they have been. And I'm very proud of the team. I'm proud of how passionate that they are about the work that they do. The lead team continues to have record numbers for lead testing every month. They are incredible. They're the highest number they've had. TB is very robust. We are cross-training in several areas in the TB division and the lead division. So we're very happy about getting people trained to do multiple jobs when people are absent or sick. Tomorrow night, I'm going with a group of people from the different units to present at the St. Joseph County Medical Society over at Jesus Grill. So if anybody wants to come in and hassle us, they can.
Good. Tomorrow?
Tomorrow night at 6:30. Do you have any questions for me?
Any questions for Dr. McLeary on the health officer's report? Not the budget. Yeah. Having that under the,
Yeah, that was just an FYI.
we're not approving the budget as part of this item, this health officer's.
I will say, I noted like this presentation that was done at the gals, and then they get the hands-on training. I thought, well, that's genius. So is that something new or has that been done before?
Are you talking? Oh, yeah. That is a newer thing that Leela did to the kids at the res that helped with. She is very passionate about the vector.
Yeah.
So she's into ticks and mosquitoes, whether she wants to be or not. But she acts like she wants to be, so that's a good thing.
Yeah. But I thought that was cute.
I noticed for the Ember program, 92 unique participants year to date. 60 of the new participants joined in April, which that's impressive. And I just wondered how, Renata, how did that happen? How did you get such a big jump? Because that's good.
That is a typo.
Oh, no.
60 participants in April, but 16 of those were new.
Okay.
So
Still, how are you
our
getting new participants?
advertising is we do a lot on Facebook.
Okay.
The provider offices, the team, whenever they're out in the community, the CHW and the MIH coordinator, they are dropping off stacks of flyers with whoever they're connecting with, they're meeting with to talk about the program. But we actually, in our registration form, asked the participant, how did you hear about us type of thing?
Mhm.
And the number one referral source continues to be the Ember participants themselves.
Okay.
Because we do offer like incentives that if you refer somebody and they attend at least half of the class, you can get an extra entry into the raffle. If they attend all the classes, you can get some whites or, something like that. So most of the moms are referring other people, not only for the incentives, I'll say, because they enjoy the program and the content. We're building community, but also social media. We have our flyers like here, Vital Records and Nursing. Department of Health is a big referral. So is Women's Care Center in the WIC office. So like several, but everybody doesn't always answer that question. It's not mandatory, but it's neat to see because we do have provider offices in some other places too.
And are you having some in-person kind of outdoor events coming up?
Yeah, so we had our first one in, I guess, May, so that one. But yeah, we did a Moms on the Block. We did a stroll in Mishawaka. It was really cold, so we didn't come back as many people as we thought we were going to. But we also have an event in July that.
Thank you.
Any other question? I wanted to ask about the radon. Doesn't seem like we're getting good results or getting good. The tests aren't coming back.
So I think the hypothesis from the environmental health unit is that because we no longer offer remediation or to help with remediation, people are not doing it. They're not as motivated to do it because they don't want to be stuck with a knowledge and then have a $1,200 or $1,500, $1,800 bill to put in the system. We are looking at ways in our budget to bring in some money for remediation. And so we are going to bring that back. And we're hoping that that will improve. The other thing that didn't help was we had trouble with our test kits. The company that we used in Florida they used to be a mailer, like in a mailing bag. You sent it, it went fine. And then they decided to switch to a plastic thing that you mailed back. And a lot of those, instead of ending up in Florida, ended up in the post office. I'm convinced on the floor in the Atlanta post office. But the point is that they didn't make it back to the lab. Or when they got there, the contents was empty. It was something damaged about the package, and the package was, and the way we found that out was the crew in environmental called down and asked one of the actual lab techs, is like, what is going on? And that was part of the explanation. So we've switched labs and they're actually cheaper, the one we found. And, but we just really have started with them within the last month, and that's the one thing that's different. We're hoping that this takes off, but also the remediation,
So you said $1,800.
depending on the size of the house.
I did a lot of radon mitigation and it's like 1,000.
Yeah, no,
But whatever company you were using was,
we give them the list.
yeah.
If it's a huge house, it's more, obviously. But that's the $1,800 range, but most of them are around 1,000.
Okay.
But some of them are 1,200, depending on how much I think has to be built into it or where they have to leave the pipes from. But yeah, it's expensive. That's a lot
Oh,
of
it is
money.
expensive. Even 1,000 is expensive.
Yeah.
So,
So is it? Yes. Knowledge is good for the people in the house, but getting 5 back out of 24. How much did the test cost us, or do we have?
It was a lot cheaper for these. Do you
I
remember?
don't remember, because we buy them in bulk, a few hundred at a time. I don't remember what cost
It was like-
us.
I was thinking it was on $7 or $8. I don't remember.
but even if you could find a company that would help somebody finance that, it would be beneficial. So they're not paying 1,000 or 1,200 in one lump sum out the door. So,
We're still working, our foundation met for the first time and to try and get organized. And so the foundation, that's one of our goals, is to get, people to donate, whether it's people who do the remediations or people who make the test kits, the labs. But we're hoping the foundation will come in handy for that sort of thing. Because then it's a tax write-off for them. Because it's a 501c3.
They could do like a matching grant program or something to the foundation. House, everybody's have.
Yeah,
They-
yeah.
that.
That would be
All right.
great.
Thank you. Any other questions for Dr. Migliori?
Motion to approve that.
Second. Thank you. Motion and second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. On to the next section, new business. Item 2633, discussion and vote job descriptions. Community health worker, disease investigation specialist, maternal infant health coordinator, school health liaison. I'll do those one at a time.
If we could do it as a group, I think it'll be fine to do it as a group. Again, they've been reviewed by the specific units, the director, assistant director, then Dr. Purushottam and Mike and I. Mike is sort of the spearhead of this whole thing. And then they go to Ellen and then they come here. So they get lots of eyes.
Thank you, Ellen.
And I'll just mention what I normally mention. We're at a point with these now where the standard language has been, we really, I think, developed that.
Mhm.
That language has been applied to each of them. For these four, primarily what's been done is updating. Some of these haven't been updated in a few years. So we just made sure that all the duties are current. There was mention in a couple of them about these folks directly supervising staff. They really don't. They contribute to the directors and assistant directors managing those staff members. And so we just changed the language to basically just pull the supervisory language out. Those were probably the two biggest changes that were made. Mostly they were accurate. We just cleaned them up, made them current.
So no changes, we're good to go as presented?
So that's really it for these. We've got this down to a science.
So,
We're hoping to be done by September with all the jobs.
Oh, wow.
I make a motion to approve item 2633.
second,
a motion and a second. Any further discussion on any of the position description? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item, 2634, discussion and vote on the 2027 budget.
Gonna pull up the budget on the screen here.
Well, we're going to do these once at a time, and get through them all and then make sure.
Thank you.
Let's go through them all to make. Just for clarification, once again, this is the updated one. Using all the FHI.
So the finance committee did meet, and you're going to talk us through the changes, Amy?
Yep, absolutely.
Did meet and approved what was probably draft 3, I'm guessing,
Correct.
3 and 4 and some, but, and then based on Dr. Migliori's explanation, there's some changes to propose today for the board's approval and action.
And as I go through this, if you have any questions, obviously that I don't touch on, feel free to ask those questions. I'm really just going to highlight anything that's a major increase or decrease from the previous adopted budget. But just as a reminder, between our 25 and 26 budget, we decreased all of our budgets that we had by 38.5% or $4.5 million. And we are now again reducing our budgets based off the recommendation of the elected officials. They did suggest a salary increase for staff at 75 cents an hour, which for our staff being 75 hours in a pay period, that comes to $1,463 annually. As Dr. Migliori mentioned, we did move 5 staff members to HFI funding to use more of HFI funding and to help the county with that $2 million deficit that they are facing in 2027. Some of the accounts are going to show a decrease. However, for everything that was requested by the units, it was increased by 3% just for inflation. With everything going up in cost, you might not see an increase of 3%. That's because we reduced the budget, but we did build in a 3% inflation increase for our supplies, services, equipment. So as we start off in the county health fund, which is our main fund, that is our tax generated revenue, as well as our fee generating revenue. I refer to that as our main general fund. The 3 registrars that are the 3 positions that were moved to HFI funding, as well as the director and the assistant director. Everything for the vital records unit pertaining to personnel was moved to HFI funding. The full-time CMA, that is not a new 2027 position. We added that to our budget in March of this year, so that is already in our budget. It just does not show as a 2026 budget item since it was done after the budget was approved, but that is already in our budget. It's already been approved. There's no additions being done for that line item. For the account 11184, we are eliminating one of our environmental health specialist coordinators. That was just additional duties that was given to a EHS position. We still have that EHS position, just those additional duties have been removed. What happened is the person in that position moved up to the assistant director position. And then it was determined with that leadership that wouldn't need to be backfilled in that coordinator role.
And could you go back to the last item there? To explain one more time, it's in the budget, but it's not in the budget.
Correct. It's currently in our budget due to the fact that we moved money around. It was a part-time position, so we took the money from part-time and made a full-time CMA. So it's going to be a budget neutral item where for 2026, it doesn't show here, but there's money down below in part-time that is being removed.
Thank you.
And that'll happen again in HFI since it is a split position between HFI and the county health fund. It'll be the same situation in that fund.
So can I just ask, so the 2026 numbers are what were approved in the budget last year?
Correct.
So it's not,
None of the changes that were moved around, anything.
Okay.
It's what, at this time, what the budget was approved
okay,
in 25 for the 26 budget.
okay, so that's what we're comparing. We're comparing
Correct.
and in with
Correct.
this one,
This-
CF,
Yeah,
CMA, it's not quite an apples to oranges comparison.
Correct,
Okay.
correct. That is what gets
It is.
printed out for the elected officials to look at are what was the actual budget approved, budget book approved numbers, and then what are you asking for changes, increase, decreases for 27.
So now going back to the environmental health that you were just talking about, did you eliminate a position there?
We eliminated the extra duties, not a position. That EHS position is now filled with our most recent hire, but they are not going to have any additional duties that would warrant extra stipend. So they're doing the regular EHS duties without overseeing a program. Because we had the two coordinators we had was one the one that is still in place oversees the septic program. The other one was over the water program. And that is the employee that moved up to the assistant director role was the one that was over the water program.
And she's still spearheading that.
Okay.
It's not, she's also the assistant director of the unit.
Okay.
So she's keeping the same things that she was doing, but she's also the assistant director.
But the assistant director previous to her,
Didn't do that.
exactly. So now she's got more duties.
And she says she can handle it.
But she's being paid the assistant director.
She's
so-
being paid the assistant director.
Cause I remember a year or two ago, maybe 2 years ago, we put a couple of these extra coordinator positions in.
Yep.
To kind of acknowledge that at the time, some of the specialists in a couple of the departments had been, because they were there longer and were kind of more senior, they've been taking on extra duties. But, and so we felt they needed to be compensated, but what
Yeah.
you're saying is that the way things have been shifted around in terms of the work being done, there's no extra work that needs to go to one particular
Right,
environmental health specialist. Right?
right.
Okay.
I feel like we're losing a person that way.
I think,
We're losing a body.
no, we're not.
So you can see the line. $2,200.
Yeah, we're not losing a body. It's just the additional duties is not being added on to an EHS position. It's being absorbed into the assistant director position.
Following the person rather than the title.
Correct.
Okay.
Yeah. Then as we go down to the part-time line item, this is where you see we did have budgeted for the nursing registrar that turned into the full-time CMA, which now is $0. So that balances each other out. And then, of course, with the reduction in personnel for the vital record staff, there is a reduction in the benefits that get tied to that as well.
But that's being shifted over to HFI.
Correct.
So that's going to be reflected in.
Yeah, it's budget neutral.
I realize I should probably clarify this on the record. So we are not adding staff, but we are not losing staff. This is allowing us to keep all the staff that we currently have.
Correct.
Absolutely. Yep. And then as we go through the 20,000 series, which the numbers on the left, those are all of our supplies. The second one, the 22119, that is just a reallocation from an account down here that we had called information technology. So it's just reallocating the funds to computer supplies instead of something being in a service, because that's what if we need to purchase a printer, if we need to purchase an external hard drive, anything like that, it comes from that line item. So just recategorizing it to where it fits better.
Okay.
And then as we go through and look at account 32021, which shows that there was no budget last year. This is parking rental. It is not a new expenditure because it used to be built in to the line item right above it. What it is we do offer a subsidy of $10 per employee for parking if they pay for parking. So we're just taking that out to increase our transparency. that it is for parking rental, not for travel or mileage. So we're just taking some money from the travel account and creating a new account to have that line item separated out. As we go down to postage, you see a significant increase of $3,200 is the increase. That is due to, hopefully, we're not going to have to use it, but if the courier service from the State Department of Health were to be eliminated, then we would have postage available to send. It's used by our vector program, our TB program, and our lead program. So if that courier were to be eliminated, it did get greatly reduced where they only go to certain counties now. We want to make sure we have funds available to send those samples down to the State Department of Health. Or account 39600, that's a refunds account. In the past, there were enough funds available in other accounts where if a refund was needed, I could say, okay, give me the $50 from travel and mileage and let me put it in refund so I can issue that $50 refund. We are getting very lean and I don't know that that's going to be an option going forward. So I wanted to make sure that there were funds available specifically for refunds if a refund is needed. If it's a same day transaction, this wouldn't be needed, or if it's a credit card transaction, this wouldn't be needed. It would be for a cash or a check written from a previous day's transaction. That's when a refund could be requested for any of the units that take in funds. And then again, just a reminder that information technology, we're not removing that dollar amount. It was put into the 20,000 series. So overall, reducing our county health budget by $402,307 or 8.62%, which we will see that amount in our HFI budget. Any questions on this one before I go on?
Any question?
So as we talk about HFI, otherwise the formal name, Local Public Health Services, with the vector fund, the trust fund is going to be expended by the end of this year. So we are having to move all of the vector programming and staff to HFI. So this is a new position to HFI. However, it's coming from the trust fund. So we're keeping that position, just including that into HFI. Of course, again, the accounts from the county health fund, the registrars, the director, and the assistant director coming from the county health fund. Same instance here, CMA shows 0, but it is currently in our budget, just showing what it would be for the 60% for a full year. Then as we go down to part-time, that also has a change where we took out the nursing registrar, eliminated a part-time nurse and the communication and event specialist. However, we also want to include a part-time public health coordinator, which we don't anticipate having to have someone on board immediately for that. But as some of the duties come from the State Department of Health, what is required to perform as a Department of Health, we want to have those funds available, and that would be a position that was no more than 20 hours a week. Still a net savings of $58,000 with removing those other positions and including the public health coordinator. So of course, we have benefits increasing in this instance because of those increase in staff members moved over. Then as Dr. briefly touched on earlier, we are trying to do more in-house printing. So increasing the office supply budget to purchase the paper and the color toner that is needed for the equipment. Same instance here for computer supplies, took it from the 30,000 series, which was labeled information technology, and putting it into computer supplies. According to IT, the Department of Health is up for a tech refresh in 2027. So new laptops and or a new desktop will be issued. They will not supply any updated tablets or iPads or anything of that sort. So we want to make sure we have a budget if a replacement tablet is needed, that we have funds available to do that. Our field staff utilize the tablets, our environmental health and our food staff utilize that, as well as our CHW. So we want to make sure we have a budget available for that.
So to be clear, the department's gonna get new computer hardware,
Either a laptop or a desktop
but that's gonna be paid by
by the county general fund.
okay, so not our budget.
No, this budget would be for tablets if we need a new
Okay,
tablet.
like in case the software develops and we need. Not creative.
Right, or, a screen cracks or something like that. Usually it's better to get a new piece of equipment instead of sending it off for repair, but
Okay.
as we go down to account 24120, this is a significant increase, obviously going from 0 to 66,950. This originally sat in our public info and education account for our care chronic disease program, where we were using the funds to get the program started. And now that the program is up and running, we need those funds to purchase the supplies to do the testing, the A1C testing, the cholesterol testing. So taking those funds and reallocating them to medical supplies. So we have those available to test those in the community. I believe it comes to $40 per test for the cholesterol and then for the A1C.
So the $66,000 or $67,000 increase in medical supplies
Mhm.
is covered by
By the 103,000 that was in public info last year, because we're reducing that to 1,300.
okay. And then I guess you'll tell us where the rest of the public information
Mhm.
money is going.
Yep.
Okay.
Yep. Reduction in travel and mileage. We do have some more county vehicles available for us, the county fleet, but also doing an internal audit of the Department of Health vehicles that we have and talking with the unit directors to see where they're being underutilized and then reassigning those to units that could be utilizing those. So expect to see a reduction in mileage in the near future for that. Conferences and trainings. Our MIH staff have had opportunities to attend trainings that would benefit them. And then, of course, those that they serve. So like lactation specialists, we sent some staff members down to car seat safety trainings, just having a robust budget so we can get our staff trained and then be able to offer those services to our community. Some of the funds from public info and education, due to the increase in participation in our programs, we want to make sure that we're still able to offer incentives like Renata had mentioned for raffles and that sort. So with the increased participation in those, we took some of the funds from public info and education and increased the incentives budget by just less than 35.5%. We go to environmental health, another thing that we had touched on, radon mitigation. We increased our budget to be able to offer radon mitigation again, just so we can get those wanting to test again and help them with any type of radon mitigation that we're able to. Reducing, as mentioned, the public info and education account. Vector with the exhaustion of the trust fund, having to move some of her funding over to HFI. So that would be strictly used for Vector. And then going down to information and technology, we did not cut the budget. That is up at computer supplies up top. We also have here it's slightly more than the $402,000, and that is due to the Vector EHS specialist coming over. So it's the $402,000 some odd dollars from the reduction in the county health fund, plus the salary and benefits for the Vector EHS. That comes to the $490,683 increase for the HFI budget.
And so can I ask two questions?
Absolutely.
So first of all, rent, buildings and office space. I'm just wondering, what were we spending the money on right now? Because we're not spending anything next year, which.
And we're not spending any right now. That was for our Ember program when we were renting the Beacon, and now that it's gone online, we've not had to use any of that expenditure. So we took it out completely for the 27 budget.
Okay. And then for incentives, can you give us more of an idea of what we're spending the incentive? Because it's a significant amount. So can you give us more of an idea of what we spend the money on?
So for like the MIH program, we have car seats, bedside sleepers, pampers, wipes, postpartum support, breastfeeding support. We have a list, and that's not only for Ember, that's also for the home visits. So we do have a supply for every quarter, our quarterly Ember for the 13 series that we do. But then all of the moms that we have on our home visiting, every time they go, they get pack of Pampers for the visit, the data that they collect. They also do the breastfeeding support. And then if they need supplies or help with that, we also provide that.
I don't know if anybody's shopped for a car seat lately, but they're really expensive. Cribs, any baby things, I think they have to be imported. I don't think they're made locally, and it's very, very expensive.
Well, hopefully, if you get the foundation going, hopefully that might be an area where we can supplement through community donations.
And we do have our wish list. And I want to say that for the record.
Increase there, is that due to costs or due to the program being successful and for participants?
Both. So the cost of the supplies, but then also we also budget for growth. So every year we have our ambition is to see more women and have more participants. So we also include that in the budget as well.
Next, we go on to, this is our 3rd out of 5 that we're reviewing. The opioid restricted budget, this is the budget that is held by the county commissioners. They do offer support for our health promotion specialist that specializes in injury prevention, mental health, as well as opioid reduction. So they do fund that position, the salary and benefits for that. And then we have minimal supplies and services with this position just to keep it at the $89,398. So for the account 22148, didn't have anything budgeted last year. Just thinking of possibly needing some mental health first aid materials, as well as substance use prevention education materials, and then supplies for injury prevention kits. And then the account 24120 medical supplies, if we have a request for an naloxone box in the community, we want to have funds budgeted for that.
How much? So $500, or how much does a naloxone box?
It depends. We have some requests for a wall-mounted box, some want like the newsstand box. We probably could get it for around $600. We'd have to move some funds around.
So it's basically a little cushion so that in case something pops up where somebody needs one for some reason.
Right. If we think we need an account, we want to budget something in there so we don't have to go during the middle of the year to the council and say, okay, now if I put 0 there, now I need $600. Let's just get that account created, and then we can move money around if need be to purchase what is needed at that time. So no increase or decrease for this grant. It stays at $89,398.
The busiest naloxone box, just trivia here, is outside of St. Joe Med Center. That's the one that they have to restock most frequently.
Out in Granger?
Mishawaka.
Mishawaka, yeah.
And then going to our health school liaison program. This funds the nurse as well as the salary and benefits. As we go through and look at some of the reductions here, medical supplies, just cut that in half. We haven't seen the need for a $200,000 budget for the medical supplies. This is where we have school requests from the schools. If it's not something that can be fulfilled through the Fair Foundation requests, we have funds set aside to be able to purchase items. For example, this morning we met and had a request for an AED for a school that the one that they had was donated and it's past its prime. So we still want to have funds available to purchase those type of items for the schools when they request them.
Do you have just any of you have a ballpark as to how much we spent out of this fund this year on medical supplies or
It's
what we're hitting?
most of the requests can be fulfilled by the Fair Foundation just due to the nature of they want feminine hygiene products. They need, underwear, that type of thing. That can be fulfilled using the Fair Foundation money, which we still have around $10,000 left of the original $50,000. So it's, I would say as of right now, even including the AED, which is probably going to be around $1,500, we probably maybe spent $2,000, $2,500.
Oh, wow. Okay. So
Yeah.
this is.
Yeah, we're
100
still going to be very,
Yeah.
very well off with
Yeah.
having that budget. It's just if all of a sudden everyone's AED
A lot of
needs to be replaced at $1,500 a pop, which, if they need a thermometer, that's, we can get that for $25, but, just not knowing what the schools have.
And this money is locked in for school health.
Absolutely. That's the only thing it can be
Yeah.
used on.
So what we're not spending here, we're
Goes back to the fund balance, correct?
for next year and the year after. And so
Yep.
at least for school health, we have a fund that is kind of self-sustaining for
Right.
a few years at least.
As of the most recent financials I did, we have a fund balance of about $1.5 million. Sorry. So I think we're gonna be fine for a while as long as we don't have an influx of expensive requests coming through. I think we'll be fine. Oh, gosh, that's my dad. I'm so sorry. He's like, why is she not answering? Are you okay? I know, bless his heart.
Is he okay? Yes.
Well, Jen, can you call Dad?
Okay.
You probably tried calling Jen. She's not answering. I'm not answering. Oh my gosh, where am I going? So then as we go through and look at the school liaison, of course, that reduction, conferences and training, just cut that in half, I don't believe we used any last year, but we do want to have some funds available for our nurse to be able to attend trainings, but then also to have another school health nurse conference.
Mm.
So we want to make sure we have funds for that, but $5,000 is sufficient to have that. So overall, this one does have a budget reduction of $102,897. Still, very robust for what we need for the year. Then our last one is going to be our NACCHO mentor program. This also funds the personnel or doesn't fund the personnel, it funds the programs that fund the opioid restricted staff member. So these are the funds that will be left over. This fund was a deliverable base. So we already have all the money. Now we're just spending it down. So this is how they request to spend the funds down for the 2027 year. Same thing here, medical supplies will go towards naloxone boxes. So this fund would be used first for certain items. If it pertains to opioid reduction, that is going to come first from here. And then once this is exhausted, it would go to the opioid restricted. This can only fund that where the opioid restricted can do mental health, injury prevention, can do a wider array of services that can be done. The only major change here is printing. If we need to send something out for printing to one of our local printers, we just wanted to make sure that we had some funds available to do so. So the decrease here, mainly because the funds have been exhausted, not because we don't think we need, $26,000. It's just the funds will be exhausted. So reducing the budget just shy of 62% overall.
This was a grant from the state years ago.
From NACO. Well, not from the State Department of Health, but from NACO. Yeah, it was a deliverable-based grant where our employee was a mentor to two different departments of health outside of Indiana. And then she had to do deliverables to receive that money, and we're still utilizing those funds.
But this will be spent down at some point in 2027. And then whatever needs to be, any continued funding of these programs of what's on here will come out of the opioid fund.
We'll request that.
Okay.
It'll be up to the commissioners and the council if they'll let us increase that budget since it's their funding.
Okay.
But we will definitely request it from there.
Okay.
And if, that's not an option, we'll, seek other funding. If that's not available, then if HFI funding's available, we'll roll this to HFI funding.
Great, thank you. Questions? Dr. Harding.
Unfortunately, in your initial plan, $402,080 represents 8.2% reduction. I read that correctly?
Mhm.
Okay. So for a broader review and understanding and looking at this from a satellite view of St. Joe County budget moving forward, are all other county departments participating at that same level of reduction?
We're not.
Or are there?
We're not reducing that. We're just moving it to the
Okay.
state budget part to give the county a reprieve for a year.
Okay, so is there an awareness of how many other departments are being asked to reduce?
A general letter came out from the county auditor, county council, county commissioner's office, stating, we would like for you to give your staff a 75 cent an hour increase. However, you do have to have a flat budget. So we did obtain that. And then as we spoke, as administration spoke, looking at that letter, they said they are going to have a $2 million deficit in 2027. And also with the information that came back from the local health department symposium that the state puts on, stating that legislatures want us to spend our money. So we thought in the best interest of the Department of Health and I guess lending a hand to the county, good faith effort, that we're willing to move 5 staff members to HFI, but we are going to make sure that we emphasize in those one-on-one meetings that we have in mid-July, end of July. This is probably a 1-year move only. You can count on us coming back in 2028 to ask for those staff members to be put back into the county health budget.
So this is kind of a killing two birds with one stone scenario where we're
Right.
trying to help, we're trying to be good players in terms of helping the county get
Mhm.
through this hump
Yep.
fiscally, but at the same time, the thought is that it might benefit us, kind of a political move almost in terms of benefiting us downstate, because we're showing that we got this money from the state, we're spending it. So that
Give us that again.
give us more money.
Right.
Spend it. We need it.
Yeah, and more.
So, Amy, your
Interesting
experience,
logic.
your experience is is the council gonna say, no, too bad you did it last year at this and not gonna give me that back?
Well, I mean, the program is a state required program. I mean, we have to offer vital records. That is in state statute. We can't not offer vital records. We do have some programs in the department that are state mandated. Vital records is 100% state mandated. We have to offer vital
But they could
records.
say, yeah, you do, but something else.
Again, the hope is that when the money comes to 2028, they'll recognize that we helped out. That's the one I'm more meeting.
There's no guarantees.
Yeah.
Could there be some more money from FHA, whatever,
It's fine.
so that we could then
Could.
still continue doing what we're doing here?
It could be.
Yeah, so there's, I mean, there's no guarantee of anything. Except if
I think it's hard to say, there's so many moving pieces at so many levels, both locally, but at the state as well, that just kind of have to see how everything falls in the next year or two.
So the county hasn't said at this point, all departments for 2027 will have a 3% reduction or 10% reduction in services.
No, they just asked for flat budget once you apply those raises to the staff members at the 75 cents an hour.
They wanted to make sure that we paid for the raise.
Yeah,
The Dr. Purushottam and I recently met individually, like either with Teams meetings or in person with local officials. And one or two of them asked us how, when we meet with them in June, how we're going to demonstrate that we've cut, 2 to 3% off of our budget. And so I was sort of thinking, we already gave up 70%, 70% of it last year, but this is a good faith demonstration of trying to help.
well, notoriously, over time, the health department has always been one of the leaders in finding ways to make it work with less. Not having a lot of faith in the state legislature. The concern that I have is that get to that political issue of what department becomes more important, and what services become more important. And the county commissioners become a bit more involved, and the council becomes more involved, and we get into what's more important, the police or health, or those kind of things. So we just have a history of that trust level not being there, where you've done an excellent job, with this, but thinking down the road and thinking where the state is headed, just need to think this may be the first time you can do this, maybe again next year, but the outlook doesn't look good. So that's all.
All right, thanks. Any other questions?
I mean, I have to admit, even though I've met slicing, dicing a little bit, I'm glad that everybody is going to get at least a little bit of a pay bump. And hopefully that'll help a little. For all.
And I would say, considering all the constraints you guys have had put on you, impressive work.
We're gonna put a letter together or something with the council saying we're being nice this year. We always seem to come out on the short.
Please remember how nice you were.
Don't matter. Something. All right. With no further discussion, we'll entertain a motion on the budgets.
I move to approve item 2634 on.
Second,
We have a motion and a second. Any further discussion?
we're just, we just are making one motion to approve it. We don't have to approve every single, okay.
Right.
I'm good.
Hearing no further discussion, all those in favor, please say aye.
I,
Opposed, say nay. All right, motion carries. Thank you very much. Thank you for all your hard work. Dr. Migliori, Dr. Prosciutto, and all the directors, of course. Next item on the agenda, grant requests. Item 2635, discussion and vote to receive state routes to school mini grant. Right.
My name is Hope and I'm the school health liaison. And you may recall that in March, we requested approval to apply for a grant through Safe Routes School for the purpose of having a bicycle safety rodeo. That would include safety training and awareness, bicycle maintenance, an obstacle course, things like the new challenges, distracted drivers, and how to get kids back and forth to school safely and out in the community on bicycles. So we're excited to share that we were granted the full request, which came out to $9,052. And we have our community partner meetings that is getting underway. So we'd like to request that that be approved so that we can accept that.
Thank you. Good job.
Thank you.
Great.
Team effort. Shock and delight to us to learn we were
Yeah.
granted that money.
Congratulations.
Fantastic.
You said, what did you say the amount was that you were awarded?
9,052. So on paper, it looks like 9,052.
Okay. Because it says on here, the grant amount request was actually 8,500.
Correct.
So you got a little more.
Yeah, so this is the first time I've written a grant or done a bicycle safety rodeo. So as I was talking to community partners and learning the different things that would be needed and suggested, then I went back to what I was proposing and added and took away certain things. So that's the amount that we ended up with. Was
Okay.
10,000. And out of, you could have requested up to 10,000, I believe.
Can you tell us, do you have more specifics on where the bike rodeo will be held?
Sure. So thank you for asking that. We are having it at John Young Middle School,
Oh, out in,
which is a school city of Mishawaka
Yeah.
school. Mhm. And we're partnering with School City of Mishawaka, who is waiving like the rental fees as a partner. And then we're also working with the South Bend Bike Garage. They will be providing the talent and then like bike rentals so that youth can show up without their bikes. Maybe they don't have a bike, or maybe their parents just can't let their bikes here for the event. So we have loaner bikes that will be available that they'll also provide, and they're providing the talent. So they have LCI league cycling instructors that will specifically are trained and certified in helmet fitting, bicycle safety checks, the obstacle course, and then evaluate each child's for what they learned and hopefully grow from the experience.
is this going to be over the summer? Do you have a date yet?
Our date was just established last week, and that will be Saturday, September 26th. This fall with the rain date of October 3rd, following Saturday.
And how are you going to advertise that?
So we're looking into different things. Our primary way of advertising is through our network of school connections. So we do have nice connections with all of our school parents in Johnson County. So our primary schools, our three largest school systems being South Bend, Mishawaka, and Penn, all those schools will be provided, but we're asking them to include it like maybe on their dashboards that they use, like Parent Square, Dojo, that type of thing. Distributing flyers throughout the community through various community partners. And then I'm also looking into radio advertisements and then putting them on public, such as the Parks Department, like community event calendars,
Okay.
in addition to that. And then of course our own social media on Facebook.
So is this, I see 200 participants. So if you're going to all of those schools, I mean, are you going to stop it at 200?
Well, I'm actually planning on having a little bit of overage, so we could go to 250. But there are things like goodie bags included and such. But if they come, and when we advertise this, it'll be that those free helmets, the bike flags, the incentives will be available as supplies last, up to the first 200 participants. And we hope to have 200, because you just never know. You could have like 250, you could have 40. We hope that that's the problem, but they would still be able then to participate in the training, the helmet fitting, the obstacle course, the safety components of that, and getting the certificate.
Gotcha.
And talking to other counties who have done this, it can really vary, but it seems like 40 to 100 is a good safe number. but we are being ambitious also, and we are shooting for 200.
The other question is, it's not a home game this week.
It isn't a home game.
Okay.
I know my supervisor was like, hey, we need to look at the home. So
One of the things you learn when you move to South Bend, just put them in your calendar.
that's right. That's right.
But it's a Saturday, so what time during the day is it?
Right, and so the time will be 10 a.m. through 1 p.m. with setup being an hour before and an hour after. And I've had several meetings with the South Bend Bike Garage, who's providing the talent, or the LCI League instructors. And so we may even, depending on conversations, advertise it through 12:30, knowing that it's going to take a youth about 30 minutes to get through the 4 stations so that we can run over. But even if someone were to show up at 5 minutes to 1, we would still be able to have carryover through 1:30.
Gotcha.
Sounds good.
So a little bit in the morning and a little bit in the afternoon.
Thanks, Hope.
Yeah.
We get a motion on this item?
I make a motion to approve item 2635. I'll second.
Motion and second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2636, discussion of vote for the appropriation for the Safe Routes to School mini grant.
And this request is to appropriate the funds that Hope mentioned, the $9,052 in 3 separate line items, field supplies, incentives, and then the contractual services will be for the LCI instructors that she mentioned.
I make a motion to approve item 2636.
Second.
Thank you. We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2637, discussion and vote to apply for the Indiana Department of Health Maternal and Child Health Strategic Initiatives Grant.
Yeah, do you want me to come up here?
Sure.
That'd be great. Thank you.
So this MCH grant is from IDOH, and it is to improve maternal, child, and health outcomes across Indiana. I realized when I was rereading this, it didn't put much about the program in here. So the program as we have it designed to write for the grant is really looking upstream in terms of chronic disease and how it affects maternal health. So what we plan to do is offer the same type of health screening that we do in the community now with community health workers, but with a focus on childbearing age women or women who are very early in pregnancy. So they can have an opportunity to be screened from a chronic disease and then also have a conversation with either our MIH coordinator, who is a nurse, or Dr. Migliori. So a couple of times a month we'll be in the community is what we plan to have continued talks with some of our partners that we have ideas to be where women are who could potentially be pregnant or of childbearing age. And so the screens will be specifically for women of childbearing age. And then after they have their health screening, get their results, talk to either Dr. Migliori or our MIH coordinator, they will also have a goodie bag to take with them that includes prenatal vitamins, at-home pregnancy tests, information on chronic disease specific to what their results were, and information on how to contact us should they become pregnant. So, any questions?
Where would you have these screenings in order to, that would specifically target?
So we're
demographic?
kind of still working on or through that. What would be a women's care center? We have already talked to them and we already, have programs with them as well. And we're trying to branch out to the community. So we have a couple other places in mind that we are in talks with and going to meet with to talk about that. So we do have a few ideas.
Like babe stores or, okay.
That was actually, yeah.
Great, thank you. Any questions, other questions for Rahel?
And then what, this would specifically, no, would be at our existing community health workers. the MIH community health workers and then maybe some of the chronic disease community health workers?
Not the MIH because they're not trained in chronic disease.
Oh.
So we're really trying to look for in capacity using what we have, right? So
Okay.
we already have community health workers that are trained to do the chronic disease testing and talk about chronic disease with, the participants. So when they give them the results, that's the same time type of thing. But then after that, they would then meet with Dr. Migliori or the MIH coordinator to say like how this would affect pregnancy if they are early in pregnancy or can become pregnant. It's just thinking about how it's important, the health of the mother prior to pregnancy. We really want to look upstream, see what we can do about that.
So the idea is that they would get a chronic disease, the same screening, blood pressure and cholesterol level and things like that. But then, and would they get like the prenatal vitamins and things at that time? And then
So-
get like offered the opportunity to kind of come back for a second visit?
Yeah, and so what we have, how we've designed it now is health screen,
Mhm.
talk to the specialist. Then on the way out, you have the goodie bag with you, the vitamins, the water bottle, our contact information, that type.
Okay, so you'd probably have Dr. Migliori, MIH coordinator, maybe another nurse, kind of also at the event
Yes.
as kind of, okay.
And that's why this particular type of health screen, it would only be once or twice a month, depending on
Okay.
Dr. Migliori or the MIH coordinator's availability. So it's not going to be like the CHWs are all day, every day in the community doing the health screenings.
Okay.
there. Yeah.
Okay.
Okay.
And would this pay for a lot of the supplies probably that you would need?
Yeah, so the number of people that we plan to reach for the supplies for this would specifically come from this grant, in addition to a small percent of salary too for the CHWs who would be providing the testing.
Okay.
Is this in like, if we get this, is that in the budget?
We don't have that program in the budget. Our staff is currently in the budget.
Okay.
We do offer, chronic disease testing that is in the HFI budget. This grant would support this new initiative.
Yeah,
Okay. So, our staffing is already included. This just, I call it like salary recovery. If they're spending 20% of their time on this program, if we're awarded it, then we would not have to pay 20% of their salary from each other.
And when did IDOH establish this grant? Is this something new that?
So this is replacing, I think they said their Title V block grant that they had, which I'm not.
Is that something we've received in the past or?
No, this is new for us.
Okay, okay.
And they did just send out the latest data from April, was that?
Yes.
For the maternal health and who are St. Joe County isn't doing that great. We're better, but we're not compared to the rest of the states or the rest of the counties rather. And so they're trying to tell us areas that we need to concentrate on to reduce.
Oh, and this is dealing with those chronic disease factors.
Yeah.
Okay. Okay.
But if you can pick somebody up who's maybe diabetic before they get pregnant, that can help a lot of the complications.
Mhm.
Okay,
Makes
great.
sense. Okay.
Any further discussion? If not, I'll entertain a motion.
I motion to approve item 2637.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Bye.
Opposed, say nay. Motion carries.
Thank you for putting in the time to apply for it.
Yes, thanks for now. There's no old business today.
I'm remiss, I forgot to say that we have a new director of foods.
Oh,
That was officially announced.
Oh.
Karen Teague is our new director. She was our assistant director before, and you've been in the health department. Been around for a while. Just a little bit.
Yeah.
And we have applications open for assistant director. We've had several applications from within and a few from outside of the organization, and we'll be interviewing them soon. The other quick announcement that I've neglected to make was that we are shifting away from Civic Gov, the software We got the commissioner's blessings to do that. And we're going strictly to Red Cap, which is a free product. And we basically have somebody who can immediately make changes or tweak things the way that each individual unit needs. And we've got schematics online now. And that has really improved the turnaround time for the schematics builders. Like right now, I think she told us today, it's less than 24 hours. Like they're getting those schematics turned around because you can request them online and pick them up the next day. And that's a transparency that came because of Red Cap. And so we're moving ahead and we're forging ahead with the technology to make things more efficient, more transparent. And there's light at the end of this tunnel.
And is it less expensive than Civic? And are we saving some money over Civic Gov then?
It's free.
It's free.
It's a
Okay,
free
but are we
product.
paying for Civic Gov?
I think the county is paying for it, but there has been some talk. I don't know how true it is that they may abandon Civic Gov altogether. So that would save them money ahead of it.
Okay.
All right, thank you. Next item is public comment. Do we have anybody signed up? If anybody wants to speak, please sign up now. All right, thank you. Next item, time and place of our next regular meeting, June 17th at 4:30, the 4th floor council chambers. Does that seem okay?
I can't.
You're gone.
I'm
That's right.
not.
I will be gone.
2 down.
I think I can.
I should.
Up, right?
I can be there the following week. Be there any other week.
Do that now.
But not-
I think we should probably just move it now out of an abundance of caution. So that would be what, the 24th?
I can do the
Correct.
24th.
That I can definitely do.
I'm fine there.
Does the 24th work for Dr. Harding? What's your life look like? Do we want to know?
Seems like a loaded question.
Mhm. Careful what you ask there.
I'm afraid.
Have to be by 5:30.
You can always leave early.
I probably want to leave early too.
You just have to have a quorum to start, correct?
Well, yeah, but if everybody drops off, then,
We have the meeting.
To vote.
well, we can check with Chris.
If we have to leave early, I mean, there's something else I have to later in the day, so I will be quick and not talk a lot. Let's do that. How about that?
Everybody has
Will be turned off.
to keep the meeting swift.
So we want to move to the 24th, it sounds like. Anybody object to that? All right. The time and place for our next regular meeting will be June 24th
At 4:30.
at 4:30. 4th floor or 8th floor?
Location to be determined, presumably.
TBD.
Okay. To be determined. All right. Adjourned.
Thank you very much, everybody. Sorry, Dr. Harding.